It took me a while to decide whether I should or I should not spay my cat Mia. I was filled with questions and guilt. Spaying or neutering will hopefully be the biggest surgery of your cat's life, and it implies the removal of their reproductive organs and the consequent hormonal changes. And this procedure comes with many questions and for many people also with guilt. I often receive questions about spaying or neutering cats, but while Mia is spayed, I don't have the expertise, so I asked help for this one. I've partnered with Excited Cats. They are a company dedicated exclusively at providing the best kitten care resources. They even have a food recall alert system that it's free to subscribe, so I really recommend you to check it out. But today we're going to cover neutering and spaying cats, why you should do it, what are the pros and the cons, and how to take care of a kitten that has just been spayed. Let me introduce you to Isabel Ludic, who is going to take over from here.
Thanks, Albert, for the warm introduction and opportunity to talk about a really important subject, the spaying and neutering of cats. I would just like to mention that this information has been fact-checked and vet-approved by our in-house veterinarian, Dr. Paula Cuevas. What is the difference between spaying and neutering? Spaying refers to the removal of a female cat's reproductive organs, the ovaries and the uterus, whereas neutering refers to the removal of a male cat's reproductive organs, so the testicles and other related structures. What are the benefits of spaying or neutering your cat? It is by far the most effective way to reduce overpopulation of cats and essentially reduce animal suffering and overcrowded shelters and unnecessary euthanasia. On average, 1.5 million shelter animals are euthanized every year in the United States. It also helps eliminate potential health issues down the road, like various cancers and diseases of the testes, ovaries, and uterus. Finally, there are also many behavioral benefits when fixing your cat, especially in male cats who are far more prone to display unwanted sexual behaviors, such as roaming around, fighting, vocalizing, and urine spraying. So at what age should you consider spaying or neutering your cat? There has been lots of debate about the ideal age. The standard age is 6 months, although more and more vets are advocating for early spay and neuter, which can occur in kittens as young as 8 weeks old. According to Dr. Cuevas, a cat who is not going to be used for any reproduction should be desexed after allowing 1 or 2 heat cycles to pass in the case of females, but they should be kept under strict observation and control, as females can also get quite rowdy when it comes to these times. During the heat cycle, the reproductive instincts are so strong that a cat will try to escape. Not everyone will be able to keep their pets under such strict control. That's why it's better to do this procedure as early as possible. Just note that different states and countries have different rules and regulations when it comes to these things. Is early spay and neuter safe? Although a lot of people are concerned about early spay and neuter, there have been overwhelming reports from veterinarians indicating that early spay and neuter is just as safe, if not safer, than surgeries that are done at 6 months age. Cats can get pregnant as young as 4 months old. Surgeries for younger cats are easier to perform and the duration is shorter because they are much smaller. Hey girl! Are you listening in on some spaying and neutering advice? Good, it's very important. Millie actually had a litter of kittens because I didn't spay her early enough, so learn from us. Younger cats are also more capable of quick recovery than older cats. So how long do cats need to recover after such a procedure? While many cats feel more like themselves after a couple of days, you should expect the full recovery period to be around 2 weeks. Over this time period, you'll need to take extra special care of your cat to make sure that they heal as quick as they can. How to do this? Provide them with a quiet recovery room or area where they can rest without being disturbed for the first 5 days. Make sure they have access to all the necessities. Keep an eye on them and make sure to look out for the normal and the not so normal signs and symptoms, which I'll go over in a moment. Make sure the wound is clean and the cat does not lick it. Provide the post-surgery medications in a timely manner. These are the normal recovery symptoms: eating less, sleeping more, walking slowly and a little wobbly, choosing not to jump, and appearing unfocused. These are the more concerning things you should look out for, and contact your vet immediately when any of them are present. Swelling, redness or heat at the surgery site, bleeding or a strange odor coming from the surgery site, lack of appetite after the first 12 hours, lethargy extending for more than 12 hours, walking with a hunched appearance, shivering, pale gums, vomiting or diarrhea, or when your cat feels too cold or too warm. We highly recommend contacting or visiting your veterinarian when you have specific questions or if you're worried about your cat's health and well-being. Thanks again, Albert, for the opportunity, and I hope to see you all soon.
Thank you so much for this amazing resource, Isabel. One of the main questions that I receive after people fix their cat is whether their cat is depressed or just weak. In this video, Isabel is going to cover what are the causes and signs for cat depression, so make sure to watch this video next, and I'll see you next time.